Thank you for your interest in the QuickLift. My name is Dr. Dominic Brandy, and what we're going to be doing is having a patient come in right before the procedure, and we'll see how we're going to progress on her and exactly what we're going to be doing. And then right after the procedure, we'll see what she looks like, so you get a good perspective of where you would be that first day. And then 2 weeks later, we'll have the patient come back. We'll ask her some questions, see how things progressed over the first 2 weeks. And that way you'll have a pretty good understanding of what you could expect over the first 2 weeks after this procedure. We have Karen with us today, and what we're going to be doing is performing the QuickLift procedure. Before we do the procedure, I wanted to go over some of the major benefits of the procedure. Number one, it only takes about an hour to perform. We can do this under strict local anesthesia. We do have some patients that want Valium beforehand, and we can provide that for them. But I'd say half of our patients just use pure local, and the other half take a little bit of sedation. The other advantage is there is no bandage afterward, and patients really can get back to work very quickly, anywhere from 1 day up to a week. But those are the primary advantages, and that's why the procedure has become very popular over the last few years. If we look at Karen, you can see that right now she's got some jowling in this area, and the neck is getting kind of lax. And this is primarily what the procedure deals with, primarily from the lip down. Up in here where the nasolabial fold meets the nose, we usually use fillers in there to make that look a little better. But primarily what we're doing is we're creating an upward pull, and the reason we want to do that is we really want to try to get the neck looking a lot better. If I come from the other side, you'll see how the neck will really clean up when we do that. Now there is a little purse string suture that we do under here. And that suture is underneath the skin. It's in the shape of a little egg. And that's really the key to this procedure, because that little purse string that goes into the covering of the muscles is really what gives the long-lasting effects. That'll tighten up all the structures underneath the skin. Now the incision with this procedure goes about 1/8 of an inch behind the hairline, right about here. And then we come all the way up into this little corner. And we'll come in front here, we go behind this little tragus in front of the earlobe where there's a kind of a natural crease, and then we'll come in behind here, about 1/4 of an inch to 1/2 of an inch. And sometimes we'll do a little hockey stick if somebody has a lot of extra skin. And the lifting only really goes out to about this area here. We go out about 2 inches in comparison to a conventional more extensive facelift. You would come all the way out into here, all the way out. You would lift the skin all the way out to this area. You'd lift all this skin, all this back in here. So really, we're only lifting about 2 inches of skin to get the kind of results that we're getting. And that's why the QuickLift procedure has become a very popular procedure over the last few years. Now we're going to be taking Karen down to the procedure room, get going. Are you ready, Karen?
Absolutely.
Ready? Okay. What we'll do in a couple weeks, we'll come back and talk with Karen, see how things have shaped up for her, and I'm sure you'll be very, very surprised at how well she does. Here we are 12 days after the procedure with Karen, and as you know, we've seen Karen before the procedure, and then, like I said, 12 days later, here she is. So what we're going to do is just take a look and see how Karen's doing. You can see at this point that all the skin that was under here is nice and smooth. The jowl is gone. She has nice smoothness to the jawline. If you look up here at the incision, you can see that right now she's healing very well for 12 days. There will be some pinkness to that area that will typically dissipate in about 1 to 2 months. You can start actually putting makeup on that at about a week. It's a special camouflage makeup. Sometimes there'll be a little bit of lumpiness here. These flatten out over typically about a month to 2 months. This will just all flatten out. You really can't see that, but sometimes patients can feel some unevenness there. But all in all, at this point, she's doing very well. Right after the procedure, it's not unusual to get a little bit of tightness in opening the mouth. That typically will lessen over the first 2 weeks. So the first few days we have patients really stay on pretty much of a soft diet. and then they just progress to a normal diet over the first couple of weeks. But at 3 months, we'll see Karen, then typically at about a year, just to make sure everything's going okay. But this is typical scenario for somebody at about 2 weeks, and you can see that she's done very well, and she's on her way to having a younger face, younger life. Now, Karen, why did you choose the QuickLift versus a more conventional facelift?
Well, I didn't want to have that Joan Rivers look,
right?
To be quite honest, and I just wanted to look a little bit fresher and a little rested.
Okay. Now, have people that have seen you, I mean, what have they thought you had a facelift? What was their?
No, actually, nobody's really noticed. Maybe my sister was the only one that said I just looked better.
Right,
That's the only comment she made was that I looked better.
Right. So people didn't think you had a facelift, but they thought you basically looked better.
Ooh, she had a facelift.
Right. Could you explain to the patients a little bit about the immediate post-op, some of the tightness you might have experienced and so forth, the jawline?
I had some tightness in my jaw, but that has lessened considerably. I eat a lot of soft foods. I did have to use a baby toothbrush, but other than that, a little bit of medication for pain, and I was fine.
Okay. And how do you feel about the procedure up to this point?
I think it's great.
Okay. You have a positive. Okay. Yeah. You do look great. I mean, I think it's made a really nice improvement for you.
Thank you. I'm very pleased.
Yeah.